It's an aggressive type of breast cancer that is fast growing and has a high risk of spreading to a patient's brain. It has a higher rate of relapse and a worse prognosis than most other cancers. Dr. Sharon Wilkes is here. She's a medical oncologist at Cancer Care Centers of South Texas. She's here to talk about a study for a new drug, but also here is Teresa Martinez, who is a patient. Thank you so much, the both of you, for joining us today. So first, talk about this. We're talking about triple negative breast cancer. First, Dr. Wilkes, if you can tell us what is so dangerous about this particular cancer?
Well, it is a difficult disease to treat because there's no target for it. Normally we think about hormone receptors that we can target. This does not have any sort of target that we can easily attack. So when it does reoccur, we have to come up with novel ways to treat it. It is a fast-growing tumor, and oftentimes it will become insensitive to regular forms of chemotherapy.
That sounds really scary. I mean, Teresa, when you were diagnosed 5 years ago, you were 35, very, very young.
Yes.
I mean, tell us about the wave of emotions that kind of came over when you found out.
Well, it was definitely devastating and scary. And then when it came back, it actually came back this February, 5 years later. You know, I'm just glad that there are programs, clinical trials, like the one that Dr. Wilkes is involved in, that give hope to people like me.
And that was a perfect segue. Thank you, Teresa. Dr. Wilkes, tell us about these clinical trials.
Well, one of the particular ones that were of interest for us, for Teresa, is that there is a tendency to have gene mutations that are called BRCA1 and BRCA2. And those kinds of inherited genes make a person more prone to having recurrences. And that's very common in triple negatives, about 20% of individuals. Well, we have a trial that Teresa is eligible for that actually specifically targets these kinds of changes, the gene mutations, in women who have triple negative breast cancer. So it's pretty awesome.
So people that are out there, I mean, do most doctors, if somebody's being treated, do they know about these studies, or is this something that, how does the message get out there that, hey, we're looking for people for this study?
Well, that's why we're here tonight.
Okay.
We want to make sure our community knows. It's been actually a real difficulty to find patients who are in our community who have triple negative breast cancer, who are looking for options, to let the word get out. So we really want to make sure that individuals know about this.
And if you have more questions, we do have the number on the screen right there. It's for more information, it's 210-656-7177. You can also go to the website cancercaresouthtexas.com for more information. So lastly, Teresa, if you just have a message for, you know, breast cancer survivors or those undergoing right now, what would you share?
I would just share, be informed, ask questions, be empowered, and definitely, you know, have hope, because there is hope.
And a lot of resources here in San Antonio.
Yes.
Perfect. Thank you so much, Teresa and Dr. Wilkes, for joining us.
Thank you.